multi-specialty physician group, as well as a SaaS platform, delivering specialty care to patients whenever and wherever it's needed. So we work with hospitals and health systems around the country to bring specialty care across 15 different clinical lines in the inpatient and outpatient setting, completely clinical site agnostic and completely device agnostic. So we're seeing patients in the ED, in the inpatient setting, in the outpatient setting, and directly at home to manage their conditions, be their cardiologist, be their psychiatrist, be their neurologist of record, and help manage their care in their local community. So for example, if you're a patient, if you're a stroke patient, you've gone into the ED and there's no neurologist there, do you really want to be transferred away? And from a hospital perspective, that transfer costs potentially tens of thousands of dollars based on if it's an airlift or not, based on the outcomes of that patient. But at the minimum, that hospital has lost thousands of dollars because they started care for that patient but weren't able to complete it. On the flip side, for the patient, that transfer causes tons of stress and anxiety for the patient and their family, potentially worse outcomes because there's a delay in care. So whether the impacts we're making are by cutting inpatient transfer rates 80 to 90%, cutting in inpatient readmission rates, 30-day readmission rates, 40 to 50%, cutting outpatient backlogs and wait times by 50%, helping hospitals and health systems increase their ability to treat more complex patients locally by 30 to 50%. We're making significant and measurable impacts, both clinically and financially, to the tune of millions of dollars a quarter for these health systems, as well as hundreds of transfers saved and hundreds of patient leakages cut.